Welcome to the program. We're discussing medical regulation, regulation of medical practice in this country. This is the opportunity for you to understand who is the right person to take care of you. And as we move on, we are going to know what can go wrong and what can you as a person do if you think something has gone wrong. Before our break, Doctor, we're talking about the issue of registration. And I interrupted you. Apologies for that. Please go ahead and explain to the people that these differences, registration and then APL.
Okay, I have to say that at the Uganda Medical and Dental Council we have 5 registers. The first register is called a provisional register.
Okay.
And this is for our younger doctors who have just finished and they are under internship. I must inform the people that the people in the internship are supervised doctors. They cannot work alone. They cannot come to a clinic to work separately. So it's a provisional license and it's not a certificate.
So that means they have to work in designated areas.
Designated places, we have 26 places in the country. And that's what I said. The South community is concerned and wants to know those places if they have qualification to supervise them.
Okay.
When you finish the 1 year of probation, if you pass, then we put you on the full register where everybody should be. It's called the full register.
After completing your internship.
It's called the full register. And for people's information, we have 4,610 doctors as per today in the country, those who are in the country.
And you're looking at the living ones, or those who have registered since 1913?
No, those who are living.
Okay.
The third register we have is that one for annual license.
Okay.
The annual license, as I said, is obligatory because you cannot work without a license anywhere. The license comes up with some other issues. You need to be educating yourself in terms of CPD, continuous professional development. It's one of the requirements which we are now insisting on to make sure that you are not a rusted doctor as you are treating, because it's unethical to treat people if you are not upgrading yourself. So it is having about 2,700 doctors.
Those are the ones who have APLs?
Yes. The reason is we have about 1,500 doctors outside the country. But there are also those doctors we have said who are not in practice but on the register. Okay? Those whom you see, they are doctors, but they are doing other things, maybe business and whatever. Completely they are out. So that's why you have that difference. But those who are in practice of any sort, as my colleague explained, must have a license. Then we have a register for our facilities.
Okay,
this is the council which is in charge also of registering big hospitals and the health facilities for all doctors in the country. So we have that register showing who is the owner, the registered person, and where it is. Then the last one is called a temporary register. This temporary register is for our colleagues, the foreigners who have come to work with us. Because they are foreigners, they don't go on our full certificate, full register, because they can go anytime.
Okay.
The last one, which I don't, which we will always hide, is called the dead register.
The what?
Dead register. That's where we put our colleagues who have parted for the purposes of knowing them, and also informing the community and the fraternity of who has passed away and whatever. But I have to say, within the registration, especially of the facilities, as the people might say, we have people who are called quacks. So how do you know who is...
And how do you register them? Which register is that?
Okay, no. Who are quacks outside. How do you know who is a doctor in Uganda? Okay? How do you differentiate him from a quack?
I think one wears a white coat, one that doesn't.
Okay. Now, we at the council, we came up with the technology, which I want to communicate to the people here, that you can use your phone to know who is a doctor in the country and who is not. Because you have a problem in this country where everybody is calling himself a doctor, including the traditional healers and everybody. So if you want to know who is a doctor, you go in his SCMS, messages, you say, you write the word doctor in full.
Uppercase, lowercase?
Any.
Okay.
Leave some space, and then you put there Dungu Henry.
Oh, I'm in trouble.
Yes.
Will I come out?
Then
does it matter which name comes first, or it doesn't matter?
No, it matters.
So it has to be
surname first.
Surname first.
Yes.
Okay.
And then we send that one to 8198.
And you send it to
8198.
8198.
Yes. So this one will bring you the profile of the doctor, his name, registration number, degrees, and if he's a specialist, he will be what? It will inform you.
Let's repeat that.
Yes.
Do you want to know who is a doctor? Yes, do this. Go to your messages on your phone, type in the word doctor, leave a space, write that person's last name, which we call the surname, followed by the first name or the given name.
Yes, give the example.
Like Henry. Henry is the first name. Last name is Dungu, or my surname is Dungu. So you type in doctor space Dungu Dung Henry, yes, and send that to 8198.
Yeah.
People have sent, right?
Yes.
And they'll get to know whether I'm a doctor or not.
Yes, and it will bring you all the particulars. And we want this information to be there, and we want it to be in local language. We are going there so that people know who are treating them, if they are real doctors or other cadres, because the doctors are not the only ones who are treating. And we have worked with the other councils, because now you can also know who is a nurse and who is not. If you also put it in nurse, and you put it in Namugerwa, Harriet, and you send to the same number,
You
if
get
it's
the
a nurse, they will give you the profile. If it's an allied person, the same. We started with it because everybody was calling himself a doctor. So when we get sick, all of us, we normally go to a clinic which we know. I want you to start from today by knowing that person before you go there. The best way to fight quacks is to know the quacker yourself and you don't go there. He will close business.
Don't support them.
Don't support them. Because some of the problems which we are going to talk about discipline, cases come to us accusing people that they are doctors when actually they are not. So we want this information to be understood. Check your person who is treating you to see if he's the right one. If he's a doctor, or he's a nurse, or he's another profession, so that you can know the person you are dealing with. That is one. Two, we have gone ahead to classify also the registered facilities. Registered facilities, you do the same. If you want to know that Nakasero Hospital is a registered hospital, or Rubaga, or X clinic, that one you write clinic, space, then you put in your clinic name. You can say Rubaga Hospital. We are now talking about private facilities. Then you say Rubaga Hospital or Abbey Clinic or something like that. Then you say 8198.
You send 8198.
The same number. So it will give you the clinic, where it is, the owner, and the doctor supervising. If it is a quack, and somebody says it is a doctor, it will say that thing does not exist. Just don't go there. That is if you like a doctor. So you're working with other councils so that they also, their facilities are also put on the system so that if it is not a doctor and is a clinic officer, somebody knows. If it is a nurse, somebody knows. We want to guide the people so that they can know where they are going and they avoid the quacks who are calling themselves everything, that they are treating everything on this world.
Thank you very much, Doctor, for that very clear clarification. And just remind our viewers, at some point, we'll allow you to join us. You'll be phoning in, ask a question about what has been causing a bit of maybe lack of clarity to the experts, and then we'll be able to respond to that question. Dr. Nyankore, in terms of supervision, we mentioned that there are some people who are not genuine, and we mentioned that there are some facilities that may not be genuine. How do we go about, okay, let me start with this one. We have typed in, and we find that these doctors are not doing things well. I don't know how you can talk about discipline and supervision at the same time. In discipline among health workers.
Yeah, thank you very much.
We start with supervision.
I will start with supervision.
How is it done?
You will recall that when I was discussing about the code of ethics governing the profession, I highlighted on the ethical obligations. Now I think this one helps us to throw light to understand better how the supervision activities is done when we talk about another aspect of the ethics in the professional ethics. That is the standards of professional practice.
Okay.
So one of the things that I think all of us would like to see done right is that the person who is handling our health, the person treating us, is a knowledgeable person and is a competent person. He talked about continuous professional development that we keep monitoring, and that is something that is very important. You will agree with me that if you have never opened up a few pages of your books, you have never Googled to see what new developments there might be, you are likely going to go, your knowledge is going to go to rust. And you may be an irrelevant person in the profession, and you are likely to be a dangerous practitioner.
So you're not up to date with medical information.
We would like to make sure that you're up to date with your knowledge. Then we expect you to uphold professional standards of practice that are accepted nationally and internationally. When you come to the Ministry of Health, you will hear about the policies, their guidelines, their standard operating procedures, and whatever. Those ones are there to help us carry out our practice in Uganda according to what we believe in as the appropriate practice. And we supervise to make sure that the doctors uphold that. Then when you are offering services, obviously you need to have equipment. There are basic equipment that would help you to provide certain services. Whether you are a hospital or a health center, there are some basic equipment that are expected to be available by level of a facility. Then there are different categories of doctors. Say after qualifying, they go for their masters, they do different things. So we would like to see that you do your practice in accordance with what you have trained best in. If you are a specialist, you stick to your area of competence. How do we know that all these things are happening? We carry out routine support supervision visits in the districts, and we carry out inspection of health units. In Kampala area, for example, we always engage the KCC officials. They move with us, and sometimes they do this, and they're doing a wonderful work. We are happy. And when we go to the districts, there is this body called the District Health Supervisory Authorities. We worked very hard to establish this together with the other health professional councils. So when we go out for inspection, we would like to see that a health unit is first and foremost registered, because if it is not, it is as good as an illegal facility, and therefore it should not exist. Then the practitioners are registered, and they are up to date with the CPD and then their license.
Continuous professional
development, and they have got an up-to-date license.
Okay.
Then the practitioners, other people offering services, they may be nurses, they may be say radiographers, they may be clinical officers, because you are not going to get, say, a medical health unit where you only find doctors. There are these other categories of staff. They are always there. So we would like to see that the appropriate people have been employed to carry out their services in accordance with their area of training.
Now,
then,
Sorry to
look at the
interrupt.
kind of equipment that
Yeah.
they're using.
Go ahead.
So when we go for this exercise, we would
Mm.
like to see that the practice actually does not pose any harm to the members of the public who might not be suspecting that anything is wrong.
Okay.
Yeah.
The challenge remains like this, members.
Mm.
Me, I'm a doctor. Right now, I'm a doctor.
Yes.
But when I'm out there, I'm a patient, right?
Mm.
How will I know that the facility... Okay, you've told us about the SMS.
Mm.
Some of us don't know how to do SMS. Is there any obligation for someone to have indicators somewhere that this facility is registered? Other than SMS, is there where someone should know? Is there an obligation where health workers maybe display what talks about them? I enter clinic, I find something and I'm contented. Dr. Nyankoi.
Yes, please. We expect that this is a good practice that everybody should uphold. When you are operating a registered facility, you should be happy with the facility. And if it is licensed, we would expect you to see the license displayed in a conspicuous position, preferably in a reception, where somebody at a glance would see that, oh, this health unit is registered. In the same way, the person supervising the health unit, the doctor responsible for the services, for everything taking place there, should also be proud enough to display in a place that can be seen easily by his clients. Needs to put there what? His annual practicing license, the valid one. This would be very good. But in practice, when we get out, sometimes we are disappointed, because you find that this thing is under lock and key in the office of the doctor, in the office of the in charge. Sometimes they tell that these things are kept at home. I think this is a very unhealthy practice. And we always try to encourage them to always make sure that these documents are available to us and any other persons that may be delegated by the council to go and carry out this activity on our behalf.
Okay. So at least there should be a means of one displaying what talks about them.
Surely.
So in addition to the SMS, at least we have a provision for something like that. Okay. Now, going to indiscipline, we hear about a lot of this. And I am sure there are many questions about this. We'll go for a short break. When we come back, we are going to discuss, in summary, what we mean by indiscipline and what can be done for someone who is regarded to be indisciplined. But also, we'll be able to take some of your calls. We'll take the lucky ones who will be the first to call. When we start telling you to call, and then we hear your comments or questions. Let's go for a break and then continue afterwards.